For the past few months, health professionals in Toronto and beyond have been responding to a growing number of monkeypox cases. But advocates are ramping up their calls for increased vaccine awareness and better supports for those diagnosed.
Certainly, our efforts have been unending.
Dane Griffiths at the Gay Men's Sexual Health Alliance and his team working in overdrive to keep educating the public and those at higher risk in the 2S LGBTQ plus community on monkeypox for weeks on end now.
I think there's a feeling that we can address this outbreak and put a stop to it. And I think our community is incredibly motivated to ensure that, frankly, no other communities are affected by Mpox.
With 326 confirmed cases in Ontario to date, more than 3/4 of those people are from Toronto. So here in the city and beyond, the main focus right now, vaccination. Toronto Public Health reports more than 11,000 people have received a jab of Imvamune. In the coming weeks, there will be nearly 36 clinics to get a shot at.
That's significant, and I think it speaks to the interest in the community to pay attention to this, to take steps to protect our health and the health of folks in our community.
Griffith says there was a larger spike in interest just before Pride at the end of June and after the WHO issued an emergency declaration on Saturday. However, some indications of slowing uptake.
This declaration makes clear that the situation requires an urgent global response.
Canada's Chief Public Health Officer Dr. Theresa Tam says more than 70,000 doses have been distributed across Canada, and almost 40% of that has gone into arms. But that's just the first of what should be 2 doses, only enough for 1 per person right now due to rationing.
Based on global estimates, vaccine is of limited supply.
It is happening in high enough numbers in a segment of society that matters. And that is cause for all of us to be concerned.
Dr. Daryl Tan has been treating monkeypox patients at St. Michael's Hospital and says the severity of cases has varied widely. No one has died of the virus in Ontario, but the recovery time is 2 to 4 weeks. He's calling for more support for patients who are forced to isolate for an extended period of time under infectious disease protocols.
People want to follow public health advice. People don't want to expose their friends and family to the suffering that they've just endured and are enduring. It really behooves us to put back into place measures that have been introduced.
Measures like extended paid sick leave for workers, help getting groceries, support seen during much of COVID.
This is a virus that is causing human suffering. It's an infectious disease for which, fortunately, we have some biomedical tools and some public health strategies to contain. And we're simply trying to raise awareness, to protect each other, to support each other, and to care for people.
In Toronto, Nick Westoll, City News.